Good evening, everyone. Today we are here with another episode, and today our topic is diarrhea. Hello, I am Dr. Riya Saha, MD Medicine, and we have with us Dr. Krishanu Banik, DM Gold Medalist Gastroenterologist. And today our topic, as I said, diarrhea, a very common problem that we as doctors very often face, and you as patients. It's a very nuisance and something that can be, as patients, regarding diarrhea, it can begin and conclude in a few days, and it can linger on for a long time. And so today we thought of discussing about the various facets of diarrhea. Good evening, sir.
Good evening.
So, sir, starting with today's discussion, my first question to you would be, what is diarrhea, for all to understand? What do we mean by diarrhea?
Look, in Indian context, common people mean different things by the term diarrhea. Sometimes it is the increased liquidity of stool, sometimes it is the increased bulk of stool, and to some of the patients it is the increased frequency of stool. So it is a constellation of different kinds of symptoms, different kinds of experiences, which patients tell when they tell us they use the term diarrhea. So it is not a very straightforward diagnosis, rather it's a bit confusing term both to the patients and to the doctors as well. What we mean by diarrhea is that when the daily stool volume is or weight is more than 200 gram, which is very, very difficult to measure, is diarrhea by definition. In simple words, when a person is passing more than 3 stools per day, and or he or she is passing more liquid stool than his or her normal consistency of stool, is diarrhea. So diarrhea is a broad term. Sometimes patients also mean to say some different things, but they express it as diarrhea, and sometimes it's also very difficult for the physicians to interpret what patients are trying to say by the term diarrhea.
Yes, sir. So sometimes the patients also they term their problems as diarrhea, but
Yes,
it is
yes.
often not diarrhea.
Yes, actually it is, because as we discussed that diarrhea is a vague term, so it is very difficult to describe diarrhea in a single sentence or few words.
Okay, sir. So then, as we proceed, what are the types of diarrhea? We can classify diarrhea based on time. We can classify diarrhea based on the stool consistency. So,
What is your experience? How often do you get patients with diarrhea in your clinic, in your medicine practice, and how frequently you get diarrhea of different classes?
diarrhea is fairly a very common problem that we encounter, especially there are some seasonal peaks of diarrhea.
Exactly.
And diarrhea, we get patients with acute diarrhea, where patients presents with symptoms having within 2 weeks. Then we get patients with persistent symptoms, when we call persistent diarrhea.
More so, India being a tropical country, so acute diarrhea is much more common, isn't it?
Quite
Because,
common.
yes, in our practice, we get acute diarrhea much more commonly than diarrhea persisting for a longer time, isn't it? So, if you ask me, the classification of diarrhea for from the perspective of a patient, from the perspective of common people, there are some kinds of diarrhea which generally start acutely, suddenly, within a few hours or 1 or 2 days, and they subside in 5 or 7 days. These are called acute diarrhea, generally persist less than 7 days. And in some cases, diarrhea persists for more than 7 days, sometimes near about a month. This is called protracted diarrhea. And some patients present with diarrhea for a longer duration, like for a month, for more than a month, 2-3 months, or sometimes for a few years. So these are chronic diarrhea. So this classification is very important from the patient's perspective also, because patients presenting with acute diarrhea are generally self-limiting, because these are caused by infectious agents. India being a tropical country, mostly bacterial infection, viral infection, and some parasitic infections cause diarrhea in acute term. And as the duration of diarrhea increases, from protracted to chronic diarrhea, the chance of getting an infectious organism as a cause decreases. And nowadays, percentage of people presenting with chronic diarrhea has increased, and there are some important causes which we'll discuss. So these are in general diarrhea in terms of duration, and in terms of other characteristics of diarrhea like the quality of stool. Sometimes it is watery diarrhea, patients present with watery stool, just like water, rice water. Sometimes it is mucoid diarrhea, mucus and a small amount of stool is passed. Sometimes it is fatty diarrhea, some oil droplets come out during defecation. And sometimes it is inflammatory diarrhea. Inflammatory diarrhea means when blood is coming out with stool. So this is according to the quality or characteristic of stool. So these are the main two classifications. One is according to the timeline duration, and another according to the character and quality of stool. So in this context, how often do you get this chronic diarrhea or inflammatory diarrhea versus watery diarrhea and fatty diarrhea? What is your experience in medicine practice?
So, in my experience, the cases of acute diarrhea far more than diarrhea which linger on chronic diarrhea or protracted diarrhea or diarrhea with fat droplets of
Yes, so
steatorrhea.
in my practice also, it is same everywhere in India at least, isn't it?
Yes, sir.
Okay.
And often the acute diarrhea cases they come generally they come within 2 to 3 days of having the problem, and they are often self-limiting like you mentioned, and often when they are severe we treat them with further medications. And generally the acute diarrhea cases, uh, they are often admitted also when they are not
Dehydration.
dehydration
Yes,
with
dehydration.
complications.
Yes, yes.
Dehydration. And the chronic diarrhea cases we have also discussed one of the reasons of inflammatory diarrhea
Yes.
in our previous podcast.
Very important cause.
So they are day by day increasing, but even then quite less than acute cases.
Yes, obviously it is always acute diarrhea which takes the upper hand, and we as gastroenterologists are more concerned about chronic protracted or chronic diarrhea because acute diarrhea is most of the time self-limiting. It resolves on its own, except for the cases which are complicated by severe dehydration or there is kidney injury due to dehydration, loss of fluid from the body, and for patients who have some other comorbidities like renal conditions, heart disease, diabetes, liver disease, or any other like arthralgia, arthritis. So, except these high risk patients, acute diarrhea is most of the time self limiting. What we are concerned about is chronic diarrhea and protracted diarrhea.
Sir, will you please explain few causes causing the chronic diarrheas and symptoms that patients have apart from having increased stool frequency?
Look, chronic diarrhea can have several causes. It may be due to some infections, chronic infections like in our country, protozoal infections and atypical bacterial infections like some bacteria called Yersinia. These are the important causes of chronic diarrhea by infective agents. And there are some other important causes which have emerged as some leading causes nowadays is inflammatory bowel disease, meaning thereby ulcerative colitis, Crohn's disease. These are the varieties of inflammatory bowel disease which we already discussed, and our viewers can watch it from our other podcasts as well. What is inflammatory bowel disease, how they present, what treatments can be given, and how these disease entities are diagnosed. There are some uh, other causes like some endocrinal causes, some hormonal causes like diabetes, Addison's disease, thyroid gland disorders like both hypo and hyperthyroidism. So there are some hormonal causes of persisting diarrhea as well. There are some neoplastic causes or disease caused by tumors, some colon tumors, colon polyps, colon cancers, small bowel or ileal tumors. Although they are very rare, they can also cause chronic diarrhea. Some drugs, some medicines. Most of the aged people or people with comorbidities like diabetes, hypertension, heart disease, and kidney disease keep on taking some medications. There are some over the counter drugs also which we often take, like antacids, PPI, laxatives. Laxatives means the stool softening syrups. So these are important causes of chronic diarrhea. Some radiation induced enteritis or colitis can cause chronic diarrhea in patients those who are being treated for cancers by radiotherapy, abdominal radiotherapy, and cancer chemotherapy. So these are the main causes of chronic diarrhea. One is chronic infections, second is inflammatory bowel disease, third is irritable bowel syndrome, fourth one is some medicines, over the counter drugs or prescribed medicines, fifth one is tumor, and sixth one is cancer chemotherapy or radiotherapy. Broadly, these are the main causes of chronic diarrhea.
Sir, is there any association of food or difficulty in food absorption associating with
Yes,
diarrhea?
yes. There are two terms we call as maldigestion and malabsorption. Maldigestion means the process of digesting the food materials are defective, and the next step of after digestion is the absorption. The digested food gets absorbed in our intestine, and if there is any problem in absorption part, so these are malabsorption. So these two broad categories, maldigestion and malabsorptions, can cause diarrhea, and they have different manifestations, which is not very important for the common people to differentiate, but it is very important for doctors, for us, to properly locate the cause, identify the cause, and prescribe them proper investigations and treatment.
Okay. So now then coming to investigations, how are you going to investigate acute and chronic? Acute
Yes.
will generally diagnosis will be based on clinical symptoms and
Acute diarrhea diagnosis is almost
straightforward.
because some specified groups, some travelers, those who are traveling, those who have come from, say, Western countries to India, and they are having diarrhea. These reasons are straightforward. These are due to infective reasons. So most of the times, acute diarrhea do not need specific investigations to identify the cause. Rather, it requires to identify the complications, like complications of dehydration, if kidney is getting affected in case of severe dehydration. These are the investigations, and these are very limited investigations for acute diarrhea. But for diagnosing chronic diarrhea, there are multiple areas of investigation, because chronic diarrhea is not a localized disease. It can also be due to a systemic disease. So in case of chronic diarrhea, we generally prescribe blood tests, some common and uncommon blood tests, endoscopy and colonoscopic tests, some imaging tests like ultrasonography or even CT scan or MRI of abdomen, some stool tests. So these are the investigations or tests your doctor will prescribe when you are presenting with chronic diarrhea or diarrhea for more than 1 month.
Okay. So then now coming to the treatment part, like you mentioned, acute diarrhea is often self-limiting,
Yes.
and in case of complications in particular age groups, or if the infective agent is very virulent, it may need further management. So,
Also
sir, will
may
you
need hospital admission.
in hospital
Yes.
admission if there is dehydration and complications? So, in short, if you discuss the management of acute diarrhea and then the chronic diarrhea part.
First, we need to know when you should go to your doctor. If you are suspecting that you are having diarrhea, then when you seek medical advice. If you are feeling very thirsty, if your urine output is less than usual, if you are getting dizzy, or there is syncopal attack, or there is blackout, and if you are having blood in your stool, pain in abdomen which is very severe, so that you think that you should get admitted, or you may or might have needed injections for controlling the pain or diarrhea. And if you are having weight loss of your body weight significantly, suppose you can identify by loosening of your clothes. If you are getting ulcers in your oral cavity or other body parts, diarrhea for more than 1 month duration itself. So these are the alarming features when a patient should seek medical attention. And for the treatment purpose in acute diarrhea, we generally give hydration, uh, ample amount of oral liquid. If the patient is able to take oral fluid, then we prescribe ORS or electrolyte rich fluid like coconut water, rice water, dal water. These are the electrolyte rich fluid which is sufficient to treat acute diarrhea. Most of the patients do not need to get admitted or come for a second visit. But in case of chronic diarrhea, we have to treat them according to their causes. And there is some symptomatic management, some anti-diarrheal agents, some antibiotics. But suppose we are dealing with a patient of IBD, inflammatory bowel disease. So we have already discussed that we need to prescribe them some mesalamine-like drugs, some immunosuppressive drugs, some biological drugs. If patient is suffering from IBS, irritable bowel syndrome, which is not so very harmful cause of diarrhea, then sometimes management of chronic diarrhea may be symptomatic. So it is difficult to summarize the treatment of chronic diarrhea in a single sentence or paragraph, but it is very straightforward for the treatment of acute diarrhea.
Okay, sir. Sir, then apart from the part where we are giving medicines, or in case of acute we are maintaining adequate hydration, is there any role of diet and prebiotics or probiotics in management of diarrhea?
Yes, we have seen, in my experience, I have seen that there is a myth of restricting oral intake in case of diarrhea, particularly acute diarrhea. So, I would urge you all that please do not restrict your oral normal dietary intake in case of diarrhea. That will get you more sick and that will get you more dehydrated. So, in most of the cases, normal food and fluid intake is encouraged. You take your normal diet and normal water, or dietary supplement, whatever you are taking. For chronic diarrhea, if the patient is malnourished, so there is a role of high energy and high protein intake. And in IBD patients, when there is symptoms of intestinal obstruction, bowel lumen narrowing, so we generally restrict fiber rich food or the small nut like foods which can swell up after ingestion. In case of IBS, irritable bowel syndrome, we prescribe low FODMAP diet. The low FODMAP is a group of diet which is easily available online, and also our ICMR website, CDC website, what a low FODMAP diet is. And viewers can refer to our previous podcast on IBS also. We have the PDF version on our website also. They can get an idea about low FODMAP diet and diet for IBS. So there is a role of diet. It is very important, but please do not restrict yourself from taking your natural food during diarrhea. That is the message.
Okay, sir. So I hope the viewers can get a clear idea about what diarrhea is and the basic lines of management in case of a diarrhea. And the most important part is, I hope now viewers won't make the mistake of labeling any number of any number of stools as diarrhea, or just because often there is frequent small volume
That
passage
is
of
what
stool.
exactly we are trying to convey the message, that please do not restrict your food intake and do not ignore the red signs or danger signs in case of diarrhea. At the same time, do not get too much worried in acute diarrhea, because they are self-limiting and that they are the majority of causes of diarrhea.
Okay. So thank you,
Thank
sir,
you.
for this lucid discussion.